Hello! Today we'll be talking about torn meniscus diagnosis, surgery, and rehab. But the big question is, what is a torn meniscus?
A meniscus is a piece of cartilage in the knee used to stabilize the joint and act as a cushion between the femur and tibia. A torn meniscus is the most common knee injury that can happen to people of all ages. However, it is most common in athletes, especially those that play football, volleyball, soccer, and basketball. Now, you may be thinking, how do you know you tore your meniscus? Symptoms of a torn meniscus include the following: pain, swelling, and stiffness in the knee, inability to rotate knee to full extent, feeling like your knee is locked in place, difficulty straightening leg, and feeling a popping sensation. If you think you have a torn meniscus, speak to your doctor or orthopedist. They will have you go for an MRI test to fully diagnose it and may even order an arthroscopy, which is a small incision in the knee where a tiny camera is used to really see the menisci. Prior to both, make sure you explain all your symptoms to your doctor. Depending on the severity and location of the injury, there are numerous forms of treatments that a doctor will recommend. If it is an acute injury, to treat the inflammation, doctors will first recommend rice. No, I'm not talking about rice to food. I mean rest, ice, compression, and elevation. To further treat the inflammation and pain, doctors may also recommend taking anti-inflammatory over-the-counter medicine, such as ibuprofen medication or Aleve. It is recommended patients ask their doctor what option is best for them, especially if they're also using prescriptions at the time. If pain and swelling reduce, a doctor will recommend physical therapy to strengthen the muscles around the knee and to further stabilize the joint. A patient should not wear a knee brace as it may increase pain and decrease blood flow to the knee. Patients may also be encouraged to use crutches to reduce the weight and stress on the knee. If the tear of the meniscus is so severe and can't heal over time, the only way to repair it is with surgery. The most common type of surgery for this is called arthroscopic surgery. As stated earlier, arthroscopy is when a small incision is made into the knee and a tiny camera, known as an arthroscope, is used to see the injury clearly. Arthroscopic surgery does the same thing. However, other than having an arthroscope go through the small incisions, through those same incisions, surgeons can repair the injury in three ways: sewing the meniscus back together, partially trimming away the meniscus, or in some cases, removing the meniscus completely, leaving the knee to only have one meniscus and not two. After treatment and/or surgery, a patient starts long-term physical therapy. Doctors work with physical therapists to customize exercises that will help the patient preserve stability in the knee in the best way possible. It takes less than 6 weeks for a person to return to normal activity.